Human Resource Management Strategic Plan, Brandy Massey, Margaret Ross, and Valerie Wright. There are many challenges facing healthcare organizations, but none as critical as those revolving around staffing. The strategic plan will address staff turnover because without competent and experienced staff, organizations are unable to provide safe, quality care. High turnover is an issue in many organizations. An acceptable turnover rate should fall between 15 to 20%, but last year the turnover rate averaged around 35%. When taking a closer look, most of the staff that left had 1 to 3 years of service. This means the organization is losing experienced staff, and that affects the quality of care provided. There are issues that arise due to high staff turnover and add to the need for a strategic plan to address the issue. For example, staffing ratios may increase due to poor staff retention. Other things that may occur with high turnover include low morale and job satisfaction, negative talk, and increased costs to the organization. One study reported that the replacement cost of a nurse could range from $10,000 to $88,000, depending on the organization. There are many elements that can contribute to high turnover rates in organizations and must be identified in order to develop a strategic plan. External factors include an aging workforce, higher levels of patient acuity, and increasing financial pressures. Much of the current nursing workforce is reaching retirement age and will be leaving, taking many years' experience with them. As more of the American population ages and enters the healthcare system, healthcare organizations are seeing higher levels of acuity. This creates a heavier workload on staff, resulting in greater stress. Reducing healthcare costs is a big focus, but as this pressure increases, so does the pressure to improve quality. Both of these filter down to direct care staff, causing increased pressure to do more with less. Internal factors that contribute to high turnover include aspects of poor job matching and onboarding processes, suboptimal pay, benefits packages, work environment, staffing ratios, and lack of advancement opportunities and recognition. Poor job matching occurs when the employee does not fully understand the challenging aspects of the job before accepting it and then leave once they encounter them. The onboarding process is critical for building a foundation of skill and knowledge for the employee to build upon. Not giving them the right amount of time or information can leave them feeling insecure and unable to perform their job. This causes them to leave an employer to seek out another environment where they can feel confident in their abilities. All of the internal factors are important to understand when developing the plan. The setting for the organization is a hospital that provides inpatient and outpatient services. The stakeholders are important in the development and implementation of a strategic plan. In the organization, the key stakeholders include executive, human resource, and nursing leadership, along with the nursing staff. It is important to have input from the stakeholders and communicate strategic plan activities and implementation efforts to them. The literature review gives a foundation of evidence-based knowledge that is incorporated into this project. The literature review investigated two main areas, which are the overview of the turnover issue and strategic plan development. The review of the issue gave insight into an acceptable level of turnover, evidence of the financial impact to organizations of failed recruitment and retention efforts, and evidence on factors that contributed to turnover. Also, information was obtained to use in the strategic plan development and evidence-based strategies for recruitment and retention. Key stakeholders will begin the strategic planning journey with the important task of assessing the internal and external environment of the organization. Team members will become familiar with strategies historically and currently used to enhance nurses' recruitment and retention efforts. The organization's mission, vision, and values will be assessed by the designated strategic planning committee to determine where the institution stands with achieving these aims. Trends will be assessed to discover the organization's nurse resource volumes, quality of care matrix, patient acuity data, current patient-to-nurse ratios, and financial indicators. Internal research will be initiated through short, written surveys and roundtable discussions with clinicians and organizational leadership. Once these key internal environment areas have been analyzed, an external assessment will be performed to research market standards for nurse recruitment and retention, concepts that ensure patient safety and optimal quality are achieved, and that nurse resources are utilized in an effective and efficient manner. The population served by the institution will be assessed for any trends or opportunities that exist in areas such as increased acuity and mean population age. The current state of the healthcare industry will be researched to anticipate future shifts such as technology growth, changes implemented with healthcare reform, academic challenges, and greater clinical needs with populations served. An exceptional important task for this team will be to assess the recruitment and retention strategies for nurses with their competitors. Areas such as onboarding, reimbursement, benefits packages, professional growth and development opportunities, staffing ratios, and recognition programs should be assessed with the competitors. Combining the key concerns identified in the environment assessment with the organization's mission, vision, strategy, and values will bring the multidisciplinary stakeholder team to the point of developing goals and objectives to form the strategic plan. The Strategic Planning Committee will come up with 2 measurable goals that directly address the key challenges and incorporate 7 key characteristics that include sustainability, performance improvement, quality, and safety, direction, focus, connection, and importance. The recruitment goal will focus on employing engaged, high-quality, and compassionate nurses. Objectives supporting this goal will involve redesigning job descriptions to align roles with the mission, vision, strategy, and values of the organization. Nurse leaders will be provided with education on the focus of nursing roles. Benefit packages will be revamped to include competitive reimbursement rates, professional development funding, and incentives for collaborating to achieve quality of care and patient experience matrix. The retention goal will focus on becoming an organization that is a preferred employer and maintains a turnover of less than 20%. Objectives for supporting nurse retention will take aim at creating a strong onboarding process that focuses on having the right person in the right role and mentoring new nurses through a nurse residency program. Employee recognition will be bolstered through efforts of recognizing nurses among their peers for areas such as mentorship, patient-centered care delivery, educator activities, leadership skills, and innovation concepts. In addition, nurses will be recognized for their years of service with a bonus and banquet. Finally, the organization will work to create a supportive environment where nurses are encouraged to be accountable and seek out opportunities to share in decision-making efforts through leadership practices that value and reward transparency, honesty, and trust. Strategic planning communication will take place via many venues on various stakeholder levels in informal and informal manners. The executive leadership and the board of the organization will have access to the summary of strategic planning efforts and will have a formal presentation of key aspects of the plan. Board approval of the plan is anticipated to follow. Stakeholders who take part in the development of the plan will communicate in a free and unrushed manner, and with excitement specific details of the plan. The initial rollout communication to all stakeholders will entail a celebration that communicates in an informal manner the various activities undertaken by the Planning Committee, along with the planned aspects of implementation for the future and the role the stakeholders will play in the implementation process. A well-communicated plan will solicit stakeholder buy-in. Time will be designated with each communication opportunity for a question and answer session. In order for the Planning Committee to ensure all stakeholders know the organization's ongoing commitment to the strategic plan, monthly updates will be provided at each stakeholder level through face-to-face staff meetings, updates on the organization's intranet site, and performance flyers located in the staff break rooms and locker rooms. It would be negligent to fail to incorporate financial analysis into the strategic planning process without effectively analyzing the funding that is available and making a comparison to the funding that is needed to completely and effectively carry out a strategic planning effort. The process will be poorly developed and implemented. Funding will need to be sought for presumed reimbursement increases along with the implementation of a robust rewards and recognition program. Additional funding will need to be allocated for professional development opportunities, along with bonus and incentive programs for optimal quality and patient experience outcomes and years of service to the organization. The rollout of the strategic plan to stakeholders will also require funding for an implementation, celebration, as well as tools such as posters and internet sites utilized to communicate the implementation and ongoing progress of the strategic plan goals and objectives. There are several funding sources that will be available to support the strategic plan. The first financial resource will be through Foundation Philanthropy money. The Foundation will create specific goals related to nurse retention by developing a nurse scholarship fund and a general nursing fund. The Nursing Scholarship Fund will provide nurses with scholarships to obtain advanced degrees. Nurses will have to apply for these scholarships, and there will be a work requirement of 2 years once the degree is achieved. What the agreement requires is for the nurse receiving the scholarship to sign a 2-year agreement stating she will agree to work for the institution for a total of 2 years once the degree is attained. The General Nursing Fund will be a fund that will be designed to provide funding for nurses to attend research or educational conferences, pay for certifications, and additional educational classes that will benefit growth and development. The second possible funding source will be adding the additional cost of bonuses and pay increases to the budget for each unit. The implementation timeline for the first year requires the development of an interdisciplinary team to develop the strategic plan. One of the first objectives of the team will be to survey stakeholders to determine what is needed for recruitment and retention of nurses. Communication is key to the success of any strategic plan, so it will be important that stakeholders are made aware of changes. The second year of the timeline involves implementing the strategic plan. Again, open communication is vital for the success of the plan. It is crucial that members of the team solicit feedback from the stakeholders and incorporate into any changes or improvements that may need to be made. The third and final year of the timeline requires continued soliciting of feedback from stakeholders and implementing changes and improvements where needed. The plan will be assessed at the end of the year, and successes and challenges will be reviewed. Evaluation methods for the strategic plan include exit interviews and tracking of turnover matrix. A lot can be learned from exit interviews. Research has proven that nurse retention can be facilitated by exit interviews. Data collection from exit interviews can be used to figure out if there is a trend related to nurse turnover. Tracking and reporting turnover rates can also be beneficial. Tracking length of service allows leaders to know if there is a specific time frame where nurses are leaving. This information can provide ways to develop and implement strategies to retain nurses. A generational analysis allows for data to be collected to see if turnover is related to specific generations. Romans 2:12 places focus on rejoicing in hope and prayer. Rejoice in our confident hope, be patient in trouble, and keep on praying. A strategic plan is hope for the future. Putting faith in God allows Him to work in the lives of His children. Christian leaders need to rejoice in the hope that the strategic plan is going to be successful and provide a bright future for the employees and organization. Matthew 13 discusses the importance of planting good seeds. Still, other seeds fell on fertile soil, and they produced a crop that was 30, 60, and even 100 times as much as had been planted. It is important that Christian leaders plant good seeds within their organization. Even if it appears that the seeds did not take root, being patient and allowing God to work will allow the seed to sprout. Sometimes all that God asks of His children is for them to plant the seed. He will send others to water, care for, and harvest the fruit. The ultimate goal of the strategic plan is to decrease turnover and increase nurse retention. With careful planning and clear communication, the strategic plan will be successful. Recruiting key stakeholders will provide the leadership that will be needed to develop and implement the plan. Careful planning will be needed to ensure that all key elements of the plan are met and put into place. Relying on God to provide wisdom and guidance will ensure triumph.